Pillar 1 of Project 2025 aims to reduce federal spending and shift responsibilities, reducing federal involvement in disaster recovery efforts, and transferring responsibilities to state-level agencies or the private sector. Conservatives see this as a chance to cut costs. However, there are some counterpoints to offer against this rationale. Reducing federal involvement in disaster recovery might seem attractive, but disasters often require resources and coordination beyond local capacities. How many state and local agencies are really equipped to handle catastrophic disasters? Federal disaster management provides critical support that states can't replicate. Large-scale events cross state lines, necessitating a coordinated federal response. Wealthier regions might manage, but poorer areas struggle without federal support. Federally managed disaster aid ensures equal access to recovery efforts for all citizens. One policy is imposing new work requirements on Medicaid recipients. Project 2025 implements work requirements for Medicaid recipients. It aims to reduce dependency and promote self-sufficiency, and coverage is limited to those working or seeking employment. Medicaid generally does not impose work requirements, but work requirements were briefly introduced under Trump, with states like Arkansas and Kentucky implementing them in 2018. Courts found work requirements violated Medicaid's primary goal. What does Project 2025 propose for Medicaid? Project 2025 proposes reintroducing and expanding work requirements for Medicaid recipients. These requirements would align with conservative goals of reducing government spending by encouraging self-reliance. Non-disabled, non-elderly recipients would need to work, look for work, or participate in job training or community service. Unfortunately, adding work requirements to Medicaid could disqualify many. This could result in the loss of Medicaid coverage. As mentioned briefly before, several states attempted to impose work requirements on Medicaid recipients during the Trump administration. Arkansas and Kentucky led these efforts. Legal battles ensued over whether these requirements aligned with Medicaid's purpose. In 2019, Judge James E. Boasberg ruled against the work requirements. These rulings halted the implementation of Medicaid work requirements in several states. Why do mandates for federal agencies matter? Federal agencies like the Department of Health and Human Services or the EPA are created by Congress and have a statutory mandate defining their purpose and scope of work. These agencies implement and enforce laws passed by Congress, guided by their statutory mandates. For example, the EPA protects human health and the environment, while CMS oversees healthcare programs like Medicaid. Any new rule or policy must align with the statutory purpose defined by Congress. If a rule contradicts this mandate, it may be challenged in court as a violation of statutory authority. Here's a hypothetical example. Imagine Congress creates an agency to ensure high-speed internet access for all. The agency subsidizes internet for economically depressed areas. Then, the president orders the agency to deny benefits to those without children. Courts would likely rule this directive contradicts the agency's purpose. If Trump wins re-election, expect similar legal challenges. For more Christian news, subscribe to our newsletter.